So today we're going to talk about runner's knee pain. And this is something that we see a lot of. And some of the things, make sure you stay tuned to the end. Some of the things that we're going to be showing you are some mobility stretching and mobility testing that I'm pretty sure not many people will go through with you. And we're going to talk about some of the pitfalls and things like that with runner's knee pain. So let's get started. So, what is runner's knee? So, when we run, it's very repetitive. It's doing the same thing over and over and over and over again. So, if you have anything that is not working correctly, you're going to start having problems. And the majority of the time, you're going to start feeling this in your knee. So, typically, you'll feel something in the front of your knee, you might have something to the side of your knee or the inside or the outside, but this is typically kind of where we feel the knee pain. So, what do other healthcare providers miss in treating this? So, there's a lot of frustration with this, and we hear stuff like this all the time. A lot of times as runners, they're very type A type personalities, so they're going to go to YouTube and start figuring out what are some of the things that they can do. And they get frustrated with a lot of the healthcare providers because of some of the things that they do. And we're going to talk about that. So, one of the things is they only look at the knee joints. They're only looking at where the pain is. And so when you go to a doctor and they're looking at this and they're doing imaging, and if we happen to be getting a little bit older, then all of a sudden you'll start hearing things like, yeah, you've got some arthritis in the joint, and that's probably causing some of your pain. And I'm here to tell you that a lot of times it's not. And I always laugh because when you look at runners in general, there's not many runners I see that are going through total knee joint replacements. Does it happen? Yes, it does happen, but there's not many that you see going through some of these things. But yet we're running on the knee all the time. So, like, how is that possible? Are we wearing that joint out? Well, if everything is working properly, you're not going to have problems. There's no research out there showing that, running is causing knee pain. I mean, actually, you'll see more people that are inactive that are getting total joint replacements than people that are very active. Like that tells you a story right there. So when you've got to be careful when you go to places, and that's all that they look at is they only go to where the side of the pain is. Because I always say where the side of the pain is often not where the source of the problem is coming from. And so that's a problem. So that's one frustration right there. The other one is not checking the mobility of the joints. Now, what does that mean? So, we have to see how the joints move. And it's not just the knee joints, because you can have issues in the knee joint where the knee joint doesn't move. Your knee feels like it's going to give out a little bit. Like you sit for a while, you stand up and you can't quite the knee wants to kind of give out, and you start walking, it starts feeling a little bit better. There's things that can mimic like meniscal tears and things like that. So you've got to check the mobility of the knee as well. But, and so you can do things in the knee to get the mobility back that essentially it's like, oh, wow, that knee feels so much better. And all we did was did some knee mobilizations. And that those kind of things can mimic meniscal tears, but you have to check the joints in the hip. You need to check the joints in the back. You need to check the joints, the ankle joints, and see how all of these are moving. Because if you don't, you're going to have problems. So if something doesn't move very well in the ankle, let's say like one side moves great, the other side doesn't. And we're going to show you some mobility testing that you can do. In our joints, we have joint material, and sometimes we're doing stuff repetitively and we're moving in maybe a not so great position. You can tighten up those joints because you're just kind of creating a pathway. So similar to like what I described with patients is if you are walking in the grass and you're walking in the same path over and over and over and over again, you create a pathway in the grass. But if you're moving in a lot of different directions, the grass stays even and everything works well. Same thing happens in our joints. If we're moving in the same position over and over and over and over and over again, and we're not moving in all these other different positions, we create a pathway in the joint, and that creates a problem. And that can kind of lock up the joint a little bit. but it's really easy to unlock it. And we're going to show you some things that you can do. But if you can't move in that hip very well or that ankle very well, you're going to be moving around things. And then you're running repetitively as we're moving around a joint that's not moving very well, which then creates issues in the knee because the ankle joints connect up to the knee, the hip joints connect down to the knee. It's all connected. So if something doesn't move very well, you're going to be using muscles that you're not used to be using. You're going to be doing patterns that you shouldn't be moving in, and then that creates problems. So we've got to check that out, and we're going to talk about that today. So also the thing is you're only looking at the tissue one way. You're only looking at the injury one way. We see this all the time. So you go to massage, you have all these tight muscles and it feels great, but then it comes back again because the tissue is the symptom of something else that's going on. Or you go to a physical therapist and all they do is give you some strengthening. You're like, I can do this at home and this is actually making me worse. I'm going to go search something else. We see this all the time with runners. They'll go and YouTube exercises for them to figure, out like themselves, what they need to be doing. And it sort of works, but it doesn't fully work because, let's face it, you guys aren't the experts. You go and do all the research. I said, but when you can really get to someone that understands the whole body, you're going to get there much faster. Just like if you have a coach that's going to coach you to, get you where you want to get to, you're going to get there much faster than trying to do it on your own. So we need to make sure that it's not just the strengthening that you're looking at. We have to look at the mobility first. So mobility, once we get the mobility back, then we can go into the strengthening to make sure that you're not doing those same movement patterns, that you're creating the correct movement, get the correct muscles to fire so that everything can work properly. So next thing is, what are the common frustrations that we see with runners when they have runner's knee, specifically with runners? So one of the biggest frustrations, and we see this all the time, is doctors will literally tell you to stop running. And you tell a runner to stop running, it's basically their life is over, because you have to realize that when you have runners, like, this is their outlet of like releasing stress. A lot of times it's their social outlet. Like their brains function so much better when they're out there outside running. And it's like a drug for them. So you tell them to stop running and it's like their life is going to be over. And we hear this all the time where doctors are like, yeah, I just don't think you should be running. Now there's times where we might need to make some adjustments with people and running, and we try to keep them as active as possible. Like, let's do this instead of this. But a lot of times I'm fine. Like, as long as, we might have to modify some things, but we usually try to keep people running if at all possible. They are so good at YouTubing exercises and trying to treat themselves. And a lot of times this happens just because of poor services with healthcare providers. They go to a physical therapist, it doesn't really work. They go to a chiropractor and it doesn't work. They go to massage and it doesn't work. So like, I can figure some of this stuff out on my own. And they try to, and it works better, but they can't fully get back. And again, it's because of these missing pieces that you're looking at. And then they just start to fear that they're going to have to stop running. And that's a big fear of theirs. And then that's when they'll really start looking for help, because it's like, oh gosh, I'm getting to the point where I feel like I'm doing some damage and I don't think I'm going to be able to run. And I really do need to figure out someone that might be able to help me. And so this is when they start searching for places like our place, so that we can really look at the whole body and figure out what's going on. So the biggest thing is you always have to start with the mobility piece first. I always say our first part of treatment is looking at how the body moves, like looking at how the joints move. And we have to move them in different directions, and we have to give them over pressure, because you'd be surprised. You'd be like moving someone, it's like, wow, they move pretty evenly. But then you go and you add over pressure and one side can move a lot farther than the other side. That's a problem. That's an imbalance. We've got to fix some of those things. And we're going to talk about two tests that we can do here in a second. So you always have to fix that piece of it. Because like I said, if you can't move into a certain position and you're doing something repetitively, you're going around it. Like you're not going to be able to get certain muscles to fire. So you can do all the strengthening you want to do, but it's like, why am I not getting any stronger? I don't understand. The leg almost feels like it's a peg leg. Like it's nothing is firing. Like I can feel the one side working hard and the other side, I don't feel anything. These are common things that you see when something is not quite right. So you have to start with mobility first. How do the joints move? Take them through in range, really give them some overpressure to see how they move. And then once when that starts, everything starts firing or moving correctly, then we can get into some of the strengthening pieces of it. And a lot of times where people want to look at the mobility, they look at it in a flexed position. So they're looking at it from, okay, I can bring my knee and do a figure 4 stretch. Yeah, there's differences on each side. And all of a sudden they're like, but I keep on doing the figure 4 stretch, but I don't get any improvement because you're thinking it's like, oh, it's the muscle that's tight and I need to stretch the muscle. In reality, you're stretching the wrong way. We do so much activities where we're sitting and bending the hip and maybe the ankles are more in a pointed direction or whatever the case may be. How we live our day is more as we're always in a flex position. We're sitting, we're running, so we're bending our hip forward. We're cycling, which is bending our hip forward. So a lot of times when we look at mobility, we look at mobility and flexion, but we also look at mostly mobility in the opposite direction into extension. Because that's where we don't live, that's where we don't move. And that's usually what starts tightening up because we're always moving in that flex position. We're always bending at our hips. And so we've got to look at the joints in the opposite direction. A lot of times the restriction, the tightness that we feel, the muscle tightness that we feel can be a symptom. And we've had people that literally could not move their leg, their hamstring was so tight, they couldn't move it. And they're stretching their hamstring and they're stretching their hamstring. And I'm like, this is not a hamstring issue. This is a hip issue. Your hip's not moving. And we literally are taking the hip into the opposite direction of where you're not even stretching the hamstring. We're taking the hip into the opposite direction. And then as we mobilize that, then they, all of a sudden their hamstring flexibility like improves by 100%, like that. And that's what we're talking about. So just because a muscle is tight or just because you can't move into certain positions, there's usually one direction that will open it up. And usually it's opposite of what you think because it's the way we move throughout the day is a problem. We're always moving in one direction and we're never taking our body in the opposite direction. The other thing is you must check the joints above and below the area. Like I said, the side where the side of the pain is often not where the source of the problem is coming from. So with the knee, we have got to check the hip and how that moves, even the back and how that moves, the ankle and how that moves. Like there can be a combination of issues in all these areas, or there can be only one issue. Like, oh wow, the hip is not moving, and the reason, and then that's creating some of the knee issues, and they didn't even realize it because they're getting pain in the back of the knee, or the front of the knee, or the outside of the knee, and all of this could be coming from the hip. So you've got to check the mobility of that. And then we get into some of the strengthening things. And if you miss the step of this, of like seeing how the joints move, this is going to lead you down to a path of frustration because the strengthening and the soft tissue and all these things that you do that's sort of helping, it's kind of keeping you running, but it's, something is still off. It's going to lead you down the path of more frustration because you have to check the mobility. So that's what we're going to talk about next. So here are 2 mobility stretches that you can do. And so the first thing that we're going to do, I'm going to show you these pictures, is we're going to test the difference between both sides. So I just want you to do these 2 tests just to see if there's a difference between both sides. Because if you have a difference, there is a problem. And if there is a difference with either one of these mobility stretches that we're going to show you, then you're just basically going to move. You're going to be doing this stretch and really trying to hold the positions and stretch the joint. So now these may look like we're stretching the muscle, but in reality, we're stretching the joint. And I'll show you why there's a difference, because you will feel this in areas where you're feeling like you're stretching the muscles, and that's totally fine. But in reality, we are trying to stretch the joint. So here's the first one. Here's the hip mobility test. So again, what we're trying to do is we're basically going to be in a kneeling position. So it looks like we're doing a hip flexor stretch. and we're going to test both sides. So you want to try to get that hip from the back leg to touch the ground. Now it's not going to touch the ground, but that's the motion that we're trying to do. You can even use your hand on your hip to kind of push, give you some overpressure into that joint. And you're going to feel tightness, definitely in the front of the hip, but we're really moving that joint. If you do one side, it's like, wow, this one moves freely and I can go so much farther, but the other one doesn't. That's a problem. So is there a difference between the two sides? So you're basically kneeling, you're bringing that hip as far forward as possible, trying to touch the hip to the ground. It's not going to touch the ground, but that's the motion. Again, you can use your hand on your hip to kind of give you a little bit of overpressure. And if you are tight, then you definitely want to make sure that you're doing this type of stretch, holding it and breathing and trying to get that joint to open up over the next, like 2 to 3 times a day. So the next is the ankle mobility test. You're going to basically see how the ankle joint moves. So you're going to put your foot up on a step and you're going to push your knee down and have your heel down off the step. What you're going to do then is, as you're putting pressure through that ankle for that heel to drop down, you're going to bring the knee towards your toes. So you're really getting that joint to like move. And it's again, you're going to probably feel a little bit in the back of the foot because you are going to get a little bit of a stretch, but the knee is bent. You're putting the foot on the step. You're pushing the knee down to get the heel to drop. And then you're bringing your body weight forward. This is like an ankle joint mobilization. So when you do something like this, again, you want to see the difference. On this one, you may feel a little bit of tightness on the top part of the foot. And that's, well, it's not normal, but it is if there's some tightness that's within that joint. There's a lot of ankle joints in there. And so when you can mobilize this area, if you think about your ankle bones are the same bones that go all the way up into the knee. And so if there's issues where it's not moving, guess what? You're going to get a little bit more movement in the knee and muscles tightening up around the knee because you've got to get the mobility somewhere. So if you don't have it at the ankle, you're going to get it at the knee. You're going to have some problems. You may not even have any foot issues. You may not even know there's any issues down there. You don't feel anything down there. It feels completely normal, but there can still be an issue. So again, is there a difference on each side? And if there is a difference, then we need to start mobilizing it. Usually this is the direction that you need to go to. Ever so often we've got to go into a different direction, but usually this is the direction that we can go into as far as testing, as far as doing some ankle mobilizations. And so if we can get these joints to start moving, you're going to start noticing that, oh gosh, I actually feel like my muscles are firing now. My knee is starting to feel a little bit better. Again, when you have some of these things, then we can get into some of the strengthening things to get everything stronger, but you have to have everything moving first. So what are some of the other resources that you can learn from us? We have a ton of resources. Again, subscribe to our YouTube channel. We always are doing educational events and different things that we post on here. Plus, even testimonials from patients that literally have tried everything. Typically, the person that comes to our office has tried 5, 6, 7 different types of healthcare providers without having any kind of results until they get to our office. Check out our website. We have a ton of stuff on our website. It's www.empower-pt.com. And again, our YouTube channel is Empower, MPOWER, Physical Therapy. That's our YouTube channel. Check out our free knee pain report. You can go to www.empower-pt.com/knee-pain-report/, and that will get you to your free report. We'll also post links of these down below as well. If you want to work with us, there's also ways of working with us where you can come in if you're in the Dallas-Fort Worth area to sit down, have a conversation. We do this for free to really just help you understand what's going on, how we might be able to help, give you some ideas of what we'd be looking at and compared to what you've done before, and how we could, all the different areas that we look at based on kind of our conversation, and really give you the confidence that, I really feel like this place is probably the right place for us. So there'll be links for that as well. So thanks so much. And I hope this was helpful.